You. So thank you all for joining us this evening. I'm Dr. Sreeya Yalamanchali with ENT Associates in Fort Wayne, Indiana. And the goal of our talk this evening is to discuss advancements in the treatment of sleep apnea and specifically Inspire therapy. So please note this meeting is being recorded. Inspire records these meetings for future use, including potentially to use in a public forum. While speakers will take questions from the audience, I ask that you do not share specific details about your case or ask questions that seek a diagnosis or treatment. Rather, your question should be about the indications such as risks and benefits for Inspire therapy. This does not replace medical care, and I'm only providing general information and not providing you with personalized medical or healthcare services or advice. So please be aware that you are electing to ask the questions in a public forum over a platform that is not HIPAA compliant, and any information you provide about yourself during this meeting will no longer be private. And at the end of the webinar, just hover your mouse over the lower half of your screen. A bar should appear with the question and answer button. Click on the question and answer button, type your question in, and the questions will be sent to us and we'll answer them. So let's get started. So first of all, what is obstructive sleep apnea? It's a sleep-related breathing disorder that involves a decrease or complete halt in airflow despite an ongoing effort to breathe. So there's several types of sleep apnea, but the most common is obstructive sleep apnea. This type of apnea occurs when your throat muscles that support your palate, your tonsils, the side wall of your throat, and the tongue intermittently relax and they block your airway during sleep. So when your muscles relax, your airway, right about here, so this is the back of your tongue and your palate, your airway narrows or closes as you breathe in, and this lowers your blood oxygen level. So then your brain senses the inability to breathe and then briefly wakes you up from sleep so that you can reopen your airway. This awakening is usually so brief that you don't remember it. You might snort, choke, or gasp. This pattern then repeats itself multiple times an hour all night, and this impairs your ability to reach the deep, restful phases of sleep. Over 20 million Americans have moderate to severe sleep apnea, and that number each year continues to rise. So if left untreated, obstructive sleep apnea has serious consequences. On a day-to-day basis, the repeated awakenings associated with sleep apnea make normal restorative sleep impossible. So you'll have severe daytime drowsiness, fatigue, and irritability. You might have difficulty concentrating or fall asleep easily at work or even when driving. So people with sleep apnea have an increased risk of motor vehicle and workplace accidents. It also increases your risk of heart attack, stroke, diabetes, and then furthermore, the associated loud snoring can keep bed partners from getting good rest. So obstructive sleep apnea is diagnosed via a sleep study, and that can be at home or in a lab, and that's based on certain patient comorbidities. And then once diagnosed, CPAP is the frontline treatment for sleep apnea. Now, when used regularly, CPAP has great results with no risks. The problem is almost 40 to 60% of patients can't tolerate the CPAP, and that's for multiple different reasons. So because of this intolerance rate of CPAP, alternative treatment options for sleep apnea have been developed because, as I mentioned before, sleep apnea is very important to treat. So the first alternative treatment option that can be considered are called oral appliances. These are custom dentist-made mouthpieces, and they're intended to pull the jaw forward during sleep. While oral appliances have a use in patients with mild sleep apnea, they're generally not recommended for patients with moderate to severe sleep apnea due to poor outcomes. So then There's been different anatomy altering surgeries that have been developed and tried. And this is specifically to remove parts of the jaw or the tongue or throat to create a larger airway. Now, these surgeries are usually extensive, they're painful, they're destructive, and very unreliable outcomes. And so, because of that, there's a huge need for a treatment that wasn't destructive, wasn't painful, and that actually worked. And so, that's why Inspire was developed. This is an exciting treatment that was approved by the FDA in 2014 for patients with obstructive sleep apnea who do not tolerate or cannot or do not benefit from CPAP therapy. It's safe, it's an outpatient procedure, and has good overall outcomes and a good patient satisfaction rate. So this here is a picture of the actual battery that just sits right on top of your pectoralis major muscle, right below your collarbone. So you can see where this patient is holding the remote is around the area where the battery is. And once implanted at nighttime, you press the battery and you essentially go to sleep. So there's no mask, no hose, none of that. So here is a little animation that kind of goes over how it works. So at nighttime, this is your remote. That's where your battery sits. So it works somewhat like a pacemaker for a tongue. So there's a main unit that's called a pulse generator. And so in this animation, this is the pulse generator. In real life, it sits just on your hypoglossal nerve. That's this nerve here that controls your tongue. And that is just below your jaw. And so through this stimulation lead, it sends a signal to the nerve controlling your tongue movement to essentially pull the tongue slightly forward to just open up your airway. Let me play it one more time. And then at the same time, while there is a signal to the nerve controlling tongue movement, there's also a sensing lead that sits just right here on your chest, and it allows the system to send that signal of opening up your airway when the patient is breathing in and not through the entire night. So upper airway stimulation is different from other treatments for sleep apnea in many ways, including the fact that it combines surgical and non-surgical treatment. In this next video, I'm going to play a clip from a patient who underwent Inspire and her experience with it.
In our morning rounds, a treatment offering hope for millions of sleep apnea patients. The disorder causes people to stop breathing when they're asleep. An estimated 22 million Americans suffer from sleep apnea. It puts them at greater risk for diabetes, heart disease, stroke, and memory loss. Patients who are older, overweight, and male are generally most at risk. David Begnaud shows us the new option helping some patients. David, good morning.
Nora, good morning. For those who struggle with sleep apnea, treatments like the CPAP machine can be hard to sleep with. They don't always work, and a lot of people just can't get a full night's sleep with it. But now there's a new FDA-approved device called Inspire, and it's gaining popularity. For some people, it's a last resort. Their life literally depends on it. The Cleveland Clinic named this kind of treatment number 2 on its list of top medical innovations for 2018. We met a woman who finally found relief after more than 2 decades of trying to get a good night's rest.
I wasn't breathing. I wasn't getting the correct amount of oxygen. My thought process had gone.
Good job!
Peggy Saravo's memory got so bad, her family thought she had dementia. The 59-year-old was so exhausted, she says she could barely do her job as a nurse. So people were noticing it, but you were too.
I was too.
You knew something wasn't right.
I knew, not as quickly as they did, but I knew I was in trouble.
Peggy has severe obstructive sleep apnea, where her throat muscles relax, blocking her airway and disrupting her sleep. On average, she stops breathing 53 times an hour. That's nearly once every minute during a night's sleep. Give me an example of a night.
Up 4 hours, maybe sleep 2. This is the area where I would sleep.
Oxygen machine,
Correct.
CPAP.
Correct.
She tried other
Close it.
treatments.
Take the mask, bring it over my face like this.
She did not find relief from the CPAP machine, a common treatment that delivers constant pressurized air. The CPAP wasn't getting the job done, so you needed
Exactly.
oxygen on top of that.
Exactly. And then that didn't work. That's when they introduced me to Inspire and saved my life.
Inspire is a pacemaker-like device implanted in the chest. It senses when your breathing slows down and sends an electric pulse to the tongue to stimulate it forward, keeping the airway open.
This has been revolutionary. It's been a game changer.
Dr. Maurits Boone is Peggy's doctor at Thomas Jefferson Memorial Hospital in Philadelphia.
She'd given up. She had memory issues. She was miserable. This is not a benign disease. As I said, this is a killer, and it actually shortens people's lives.
I didn't realize I had it so bad.
A few months after having the Inspire device implanted,
You just need to relax and breathe normally.
Peggy went to a sleep lab to see how it was working.
Right, so listen for me on the intercom, okay? Okay, great. Good night.
They ran tests throughout the night, and early the next morning, Dr. Boone revealed the results.
So before we activated the device, we have all sorts of problems. This is basically your brain saying, I'm not breathing, I need to do something about it. And after we activate the device, it's perfect. Look at your oxygen. Nice, stable, flat line, staying around 96, 97%. So this is good as it gets.
Okay.
And as far as I'm concerned, this is a cure. This is awesome.
A study in the New England Journal of Medicine found that more than 2/3 of patients experienced less sleep apnea after getting the implant.
It was like sleeping with a herd of elephants.
For years, all Peggy and her husband David wanted was a good night's rest. And now they're finally getting it.
I'm going to show you.
Every night, Peggy turns on the implant right before going to sleep. What's it like to sleep now?
Great. Turn myself on. Go to sleep. And I sleep. And then I get up and I turn myself off. And I have a normal day like you and everybody else. Come here, Max. Come here, Doodles.
It doesn't work for everybody, but man, it worked for you.
It sure did. It saved my life.
Let it go.
Now, Inspire is not for everyone. It's only for moderate to severe cases like Peggy. And like any surgery, there is a risk of infection. For Peggy, she says her memory is back to 100% and she's sleeping great at night.
And is insurance covering?
So insurance, it's a case-by-case basis. Her doctor had to kind of nudge the insurance company along, but they do.
So this video clip was from 2018. Since that time, most major insurances are covering Inspire, and it actually became a covered benefit under Medicare a few months ago. So that is different from 2018. So that's Peggy's story. And just to add a bit more information about the procedure, so the procedure itself is actually now done through two incisions. And so one is right here below the jaw, and then one incision is right here below the collarbone. So this incision below the jaw is used to find that hypoglossal nerve. That's the nerve that moves your tongue. And that's where the stimulation lead goes around the nerve. That is then tunneled underneath the muscles of your neck to attach to the battery pack that's going to sit right here on the top portion of the chest. And then there's a breathing sensor that actually kind of curls up this way now and just sits just on top of the muscles of your chest to sense when you breathe in and out. This is an outpatient procedure, about 2.5 hours or so. Pretty fast recovery, just Tylenol, ibuprofen for post-op pain. Essentially, you're able to return to non-strenuous activities within a few days, but we usually have you avoid heavy lifting or anything strenuous for about 2 to 4 weeks. And then the battery is supposed to last about 10 to 11 years. And so in 10 to 11 years, you will need another procedure just to change out the battery itself. So you would just go in through the same incision. You don't have to mess with the leads or anything like that. It's just the battery. And then the device is MRI conditional, meaning there are certain MRIs you will be able to obtain and certain ones you will not be able to obtain. Essentially, you will be able to safely obtain MRIs of your head, your neck, and your extremities. And then the most important, and then afterwards actually, is when the device gets turned on. So we let you, we test the device after it's implanted. We make sure it's working properly, and then we let you heal for about 4 weeks. You'll then establish care with a sleep medicine physician who will actually be the one to turn on the Inspire for the first time about 4 weeks after. You'll establish some initial settings so that you become comfortable with it, so it becomes and then to look at the efficacy, we teach you how to use it, and then ultimately after a few months, you'll have a sleep study with the device on, just like Peggy did. And so this is an activation appointment where that is what will be just placed just right on top of the generator to turn it on, and you'll get more information at that visit on how to use the remote, how to use the device, and what to expect. Most importantly, does this work? That's all we care about, right? That's the most important thing. And so this has been studied, specifically hypoglossal nerve stimulation has been studied for over 20 years. So the STAR clinical trial, which involved almost 126 sleep apnea patients, across Europe and the US, evaluated the safety and efficacy of Inspire therapy. And this study was published in the New England Journal of Medicine initially, and it showed that sleep apnea patients who received Inspire therapy had a 79% reduction in their sleep apnea events and significant improvements in their quality of life and daytime function measures. So on average, before Inspires, people's sleep apnea was severe at 29.3, and it essentially dropped to 6.2, which we consider normal/mild. And there's also a significantly decreased bed partner reported snoring, almost an 88% reduction in snoring reported by bed partners with Inspire. And this was at about 3 years after the study. And the patient satisfaction rate of Inspire has been at 94%. We've had 94% of our patients had positive feedback that they were satisfied with the device, that they liked the outcomes, that they were able to tolerate it. And we are able to keep track of how many hours a night patients are using the device. And on average, patients are using it almost 6 hours a night, which is great for adherence for any sort of sleep apnea treatment. And since it's been FDA approved, there's been over 100 peer-reviewed publications. There's been 5-year follow-up data from that initial STAR trial that I mentioned. There's a registry that's looking at outcomes throughout the country, and there's almost 5,000 patients in the registry. And then, as I mentioned, we now have broad private insurance coverage for the device, and that's because I think insurance companies have realized that there's a great benefit for patients from this, and it really decreases all those other comorbidities that are associated with untreated sleep apnea. And as I mentioned, there's Medicare coverage. It's a covered benefit now under Medicare, and also VAs and military hospitals are also covering the device. So is Inspire right for you? So there are certain criteria you do have to meet to be considered a candidate for Inspire. You have to have moderate to severe obstructive sleep apnea. That's based on your apnea-hypopnea index, your AHI. That is what is calculated on your sleep study. That's how you stratify the severity of your sleep apnea. If you are unable to get consistent benefit from the CPAP, or if you're intolerant of CPAP. So you have to try CPAP first once you've been diagnosed with sleep apnea. And once you try the CPAP, if you feel you can't tolerate it for whatever reason, or the outcomes are just not what we expect them to be, then you could potentially be considered a candidate. You also have to have a body mass index less than 35. That's a height to weight ratio. And And then after you meet those criteria, you then get scheduled for an airway exam. That's a quick trip to the operating room where you are given general anesthesia and you're sleeping on the operating table. And as you're sleeping, we just take a look at your airway to assess your anatomy. And then your age has to be over 22. You do have to have a recent sleep study, and if your sleep study is not recent within the last 2 years, you may need a new one, which is something that we as the physician can order, or you have another physician like a primary care physician, they can order for you as well. So the whole purpose of this talk was just to introduce you to Inspire, but their website has a lot more information. You can review the full list of benefits and important safety information. They also have a patient ambassador program where you can reach out to patients who have undergone Inspire and talk to them about their experience with it. So I highly recommend that you visit their website, inspiresleep.com. Just round out all your information, get all the knowledge possible about Inspire, whether it's right for you, whether you'd be a candidate, and just to understand how it works and also understand its outcomes, which are quite well studied, and they do have good results. So like I said, I'm Sreeya Yalamanchali. I'm with ENT Associates in Fort Wayne, Indiana. My partner, Dr. Paul Porter, he is also trained in the Inspire device. And so both of us here in Northeast Indiana have started this program since about November of 2020, and we have had an exponential growth in the number of patients we are seeing who are interested in Inspire and who are candidates in Inspire. And so far, we've had very good results with it, and our patients are quite happy, and that's just great from a physician standpoint to see. So if you are interested in talking more to anyone in our office about seeing us or talking to Inspire about seeing us, feel free. Here's a phone number here to call 260-217-6213, or you can email entfortwayneinspire@gmail.com. There are a few numbers listed here at the bottom for detailed insurance questions or for VA questions. And then the next slide, I'm gonna leave this slide up for a bit so you can scan this QR code if you need to. They do have an app available, the Inspire Sleep app. If you download the app, you can learn how Inspire works. You can watch short videos answering the most common questions, connect with people who have Inspire, and watch instructional videos and how to use Inspire. I'm going to go to the next slide, but I'll come back to this if you missed it. That's kind of it, actually. So let me leave this QR code up here for anyone who wants to look at it. And thank you again for joining us. And I hope you got some information from this session. There's obviously a lot more resources out there. And if you have any lingering questions, I'm happy to answer them at this